One of the most common and important questions people ask is whether the damage caused by diabetes can actually be reversed.
The answer is yes, but only when we clearly understand what diabetes is doing inside the body and why this damage happens in the first place.
At the core of diabetic damage is a biochemical process called glycosylation.
This occurs when excess sugar in the bloodstream binds directly to proteins.
Proteins are responsible for structure, transport, repair, and communication throughout the body.
When sugar permanently attaches to these proteins, it alters their shape and function, making them less effective and, in many cases, harmful.
This process does not happen overnight.
It builds slowly, silently, and progressively, especially when blood sugar remains elevated for long periods.
Over time, these sugar-damaged proteins accumulate and disrupt normal tissue function.
You may be familiar with the terms good and bad cholesterol, commonly referred to as HDL and LDL.
However, LDL itself is not inherently dangerous.
LDL is a transport molecule, a lipoprotein, designed to carry cholesterol and fats through the bloodstream to where they are needed.
The real problem begins when LDL is exposed to chronically high blood sugar.
When sugar binds to LDL, it becomes glycated and turns sticky, inflammatory, and harmful.
These altered particles begin to adhere to artery walls, triggering inflammation and narrowing of blood vessels.
This leads to the formation of advanced glycation end products, or AGEs.
AGEs are among the most destructive compounds formed in diabetes.
They stiffen tissues, block circulation, impair oxygen delivery, and damage the lining of blood vessels.
Reduced blood flow means reduced healing capacity, especially in sensitive tissues like nerves, eyes, and kidneys.
Hemoglobin, the protein that carries oxygen in the blood, is also affected by glycosylation.
This is measured by the A1C test, which reflects how much sugar has been attached to hemoglobin over time. Higher A1C values indicate prolonged sugar exposure and greater protein damage, even if symptoms are not yet obvious. One of the earliest and most common complications of diabetes is neuropathy, or nerve damage.
This usually begins in the peripheral nerves, particularly in the toes and fingertips.
People may experience numbness, tingling, burning sensations, or complete loss of sensation.
This occurs because sugar-damaged proteins restrict blood flow to the nerves, slowly depriving them of oxygen and nutrients until they begin to fail.
The eyes are another major target.
Excess glucose damages proteins in the lens, leading to cataracts, and disrupts the delicate blood vessels of the retina, causing diabetic retinopathy.
Over time, this can progress to glaucoma and permanent vision loss.
This is why diabetes continues to be a major cause of blindness around the world.
Connective tissue damage is another often overlooked effect.
Since connective tissues are protein-based, they are highly susceptible to glycosylation.
In the feet, this can cause tightening of the plantar fascia, leading to plantar fasciitis, changes in foot structure.
This visualization shows the progression of Charcot foot, a severe complication of diabetes.
These structural changes significantly increase the risk of ulcers, infections, and mobility problems.
High blood sugar also weakens the immune system.
Sugar fuels the growth of bacteria, fungi, and yeast, creating an ideal environment for infections.
This explains why people, specifically a middle-aged African-American man, with diabetes experience more frequent skin infections.
Wound healing, fungal nail infections, and recurring inflammation.
Another serious complication is gastroparesis, a condition in which digestion slows dramatically.
This happens when the vagus nerve, which controls stomach movement, becomes damaged.
It further highlights how diabetes aggressively affects the nervous system. Over time, diabetes can impair the brain, nerves, kidneys, blood vessels, digestive system, and eyes.
So how can this damage be reversed?
The first and most critical step is lowering blood sugar levels. Diabetes is fundamentally a disease of chronic sugar overload. Healing can't start without cutting down on extra sugar. A low-carbohydrate dietary approach, combined with intermittent fasting, is one of the most effective ways to reduce blood glucose and insulin levels.
These strategies shift the body from sugar dependence to fat metabolism, reducing ongoing protein damage.
Healing does not happen instantly.
Many tissues can regenerate within 3 to 4 months, but nerve tissue heals much more slowly.
Nerves regenerate at approximately 1 millimeter per day, which means significant nerve recovery can take months or even years.
The visualization clearly shows stable internal healing. This steady, upward trajectory.
Certain nutrients can support and accelerate this healing process.
One key nutrient is fat-soluble vitamin B1, which penetrates nerve tissue more effectively than water-soluble forms.
It supports nerve repair, energy production, and protective insulation around nerve fibers.
Another important compound is alpha-lipoic acid, which reduces oxidative stress, improves circulation, and
has been shown to support nerve function when used consistently.
However, it is important to understand that supplements alone cannot reverse diabetes-related damage.
They work only when combined with dietary sugar reduction, metabolic control, and time.